Hello and welcome. My name is Marsha Fox, and I'm the President CEO of VNA Hospice of Southern California. I want to thank all of our corporate sponsors and donors who have so generously sponsored our event, Pay It Forward for Charitable Care. I love our charitable care program, and so does our staff. It's one of the things that sets VNA apart from our many for-profit hospice competitors, and your dollars go directly to helping patients and their families. I've always told our staff that here at VNA, the patient comes first and always will. Patients over profits has become our motto. Every day I receive charitable care requests for my approval. It's one of the most rewarding parts of my job and reminds me of our commitment to give back to the community. I'm going to tell you a few stories of how we have used some funds since our last event. I share many of these stories with our wonderful board of directors so that they can feel proud of the organization they represent. While most of our patients are elderly, we are one of the only hospices that accepts pediatric patients. Just listen to these stories. A 5-week-old baby with other family members in the home received $500 in gift cards for groceries and other necessities. The father was laid off work due to COVID. A 10-year-old patient received birthday decorations and gifts to make her birthday special. A 6-week-old baby's family received $400 in Walmart gift cards to purchase formula, diapers, and baby clothes. A 9-year-old boy in Fontana received gift cards for essential needs for the entire family. From cradle to grave, we care for all ages. Here are a few more stories about our senior patients that touched my heart. A 98-year-old Hesperia patient needed a handheld shower head to assist with bathing. A 100-year-old patient in the high desert needed and received a smoke and carbon dioxide detector. A 93-year-old Claremont patient was extremely sad and lonely because her family was unable to visit her due to COVID. We sent an aide from our private duty department to visit with her and take her for walks in her wheelchair. Your dollars made this happen. An 88-year-old Laverne patient received a TV, DVD combo, and the DVD series of Downton Abbey and I Love Lucy. This provided her hours of enjoyment since she could not afford cable TV. A 93-year-old San Bernardino patient received 2 fidget blankets. These blankets are for our patients with dementia and Alzheimer's. It allows the patient to use their hands by giving them something to focus on. They gravitate to these blankets, which have a variety of textures and activities, such as fasteners, buckles, and zippers. They keep fidgety hands busy and help restore calm. These stories are just a few examples of what your sponsorships and donations will support. You should feel very proud of that. Thank you again. Another important part of our charitable care is our caregiver respite program, Take the Afternoon Off. Every day our staff see exhausted, overwhelmed caregivers who 24/7 lovingly care for family members. These caregivers are unsung heroes who deserve a medal. This program provides a substitute caregiver for up to 4 hours each week so the caregiver can get a break. Take the Afternoon Off allows the caregiver to go shopping, get her hair done, go to lunch with friends, or go to a doctor's appointment. We have an 85-year-old patient who lives with her daughter, who is her sole caregiver. Also living in the home is the disabled sister of the caregiver. Not only does this devoted daughter care full-time for her mother, she also transports the sister to physical therapy and doctor's appointments several times a week. The caregiver is tired and has no time for herself or her own family. The VNA social worker recognized the incredible stress on the caregiver and recommended our respite program. Now, we provide a substitute caregiver every Friday evening so she can spend quality time on a date with her husband, just the break she needed. Your support through donations makes this happen. I would like to end by recognizing and honoring Dr. Tim Dauwalder, our Chief Medical Director, and his group of fine Associate Medical Directors. These physicians lead our excellent teams of nurses, social workers, chaplains, and home health aides, not just at VNA, but they also direct our hospice teams in our Apple Valley and Marietta offices. These clinicians do an outstanding job caring for patients and their families in our communities. Again, thank you for participating in our virtual fundraiser for our Paying It Forward for Charitable Care. It means so much to me, to our staff, and to the board of directors, but most important is what it means to our patients and families who benefit from our charitable care program. Thank you, and I will see you again next year. Now I'd like to introduce Dr. Tim Dauwalder.
Hello, I'm Dr. Timothy Dauwalder, Executive Medical Director of VNA Hospice and Palliative Care of Southern California. Thank you for attending and giving me your attention, and thanks, Marsha, for your words, and to all those in the VNA community and our community at large that compassionately focuses to relieve suffering. This charitable care fundraiser is very specific to meeting the needs of those that otherwise have suffering alone in isolation with less resource and support. And we are here to establish mechanisms to help these people. These mechanisms are sometimes presumed to be covered through insurance or through our current medical system, and some of that is true. We are a nonprofit organization, and we value ourselves on care before profit. And that is a true statement I can tell you from top down. We don't look at the dollar value, we look at the need to relieve suffering. And that leaves a gap. That gap does need to be funded charitably because we need to do more, not less, for those that suffer. As a community, not just those that are dying or have a prognosis of less than 6 months. I am here in the wilderness, so to speak, of outside of LA County area, borderline, where we do have patients. These patients in this area currently, you noticed I just took my mask off, are those that are underserved often and often need charitable care, just as those in the cities that may live in a hotel. Not everybody has what we have. The Part A Medicare benefit funds hospice. It is true. It funds medicines, nursing visits, my pass-through billing, for example, as a physician, but it does not cover the way and how people live their life. Food, diapers, rent, and care for general life itself. These are gaps. Times when people can't work, people are isolated from COVID. There's a time of great suffering, and we can fill that gap charitably. So there are examples that I can give, and Marsha has given many. But the bottom line is, there are those that don't have insurance and those that are underinsured. Those that don't have insurance have even greater need of personal care products, personal care support for food, and we donate our time. We can do that as an agency, and we can use our charitable care funds to augment. But those families have literally, and many times, nearly nothing but the suffering and the knowledge that they could be alone. We have the capacity to share the burden of suffering, and even though we do less than we all deserve more when we are vulnerable and sick, but we want to at least be available to those patients to the maximum capacity allowed through our generosity and compassion. It is always less than we deserve, but it is at least mitigated suffering. So I am in a place where I feel comfortable talking frankly and openly. This is not a practiced talk. This is simply a conversation with you about the need to give for those that can suffer alone when we can help be a vigilant, thoughtful witness to the life of another. There are legacies lived that we miss simply because we are not present and we are occupied with our own lives, our own success, our own money, and our own path. Nothing is wrong with any of those goals, but they can be blinding to the fact that there are those that silently suffer. So, in a nutshell, I'm here to ask for support. $5, $10, $500, it doesn't matter what the dollar value is. There will be a website link at the end of this talk that will allow you to donate anytime. And this is just our annual plea for charitable care for things that are not covered under the hospice benefit. And those things are like food, as I mentioned before, diapers, formula for babies, caregiving for the elderly that can't afford in-living caregiving, and supplemental funds for placement for appropriate levels of care for those suffering greatly. There are many ways we can use charitable funds, and as a nonprofit, we organize ourselves around charitable actions. So again, thank you for VNA and all of our sister Arbor Hospice, Community Hospice of Victor Valley, for being part of a family that's goal is to alleviate suffering. Even though falling short much of the time of the actual needs, we are part of the solution. And I appreciate your help in meeting that need. Compassion, love, thoughtfulness, and attentiveness to those that need us is a calling that those I work with are exceptional at. They meet and exceed the expectations of this. And I want to give them support, and I am there for them. So again, thank you so much for your time. I hope that you can, at least if not now, in the future, consider donating to our charitable fund to give to those that are in need. There are examples of extraordinary suffering that I can hardly talk about without tears that have been mitigated because of this type of giving. A baby being cared for, the loneliness of an elderly person being addressed and thoughtfully managed. So thank you so much for your time, and I will see you again. This time of COVID is isolating anyway and confusing and full of its own risks and uncertainties, and that can be isolating and divisive. And I know that regardless of where we sit within this, that we care about each other more than we care about that divides us. So I use that compassionate foundation to bring us together today and hope that we can do more. So thank you again just for your attention alone. The link will be provided shortly. Thank you.